today offering an agency presentation on her placement at Centerstone. Centerstone is a multi-state mental health agency. My placement is at the Alton office, also known as the West Center, within Centerstone. The hours of operation are 8 to 5, Monday through Friday, with a 24/7 crisis intervention line. Services include counseling, addiction recovery, school-based therapy, art therapy, housing, pharmacy, crisis, vocational, and primary care, which involves in-home care. There are other locations in Illinois for a total of 10 sites, including Carbondale, Carterville, Marion, Anna, and West Frankfort. Indiana has 26 sites in 22 cities. Florida has 11 sites in 5 cities. Tennessee has 33 sites in 21 cities, with their administrative offices in Nashville. Their military services is a national provider network with administrative offices in Nashville. The sites for Centerstone include residential treatment centers, full-service centers like Alton, or specialty centers in substance use disorder or other types of care offered by Centerstone. They also have their own hospital in Tennessee. Centerstone unofficially began with 4 churches who combined to create the Bellwood Home for Children in Nashville, Kentucky in 1849 as part of a reform movement in mental health. Other churches and organizations founded other children's homes that were later wrapped into Centerstone, which we will see as the timeline goes forward. In 1956, the D.D. Wallace Center opens in Nashville with funding from the Junior League. In 1957, the Harriet Cohn Center receives a charter in Tennessee. In 1964, the first Columbia Mental Health Center opens in Indiana. In 1967, the Highland Rim Mental Health Center opens in Tennessee. In 1997, Centerstone forms under that name through the affiliation of the D.D. Wallace Center, Harriet Cohn Center, Highland Rim, and Columbia Area Mental Health Centers. In 2008, Quinco joined Centerstone to form the nation's largest provider of community-based behavioral health. And they continue to expand in 2014 when the H Group joined Centerstone to expand their services into Illinois, which brings us up to date. The mission of Centerstone is delivering care that changes people's lives, which Centerstone refers to as the noble calling, which we will see later in the presentation. The goals and objectives of Centerstone in general are to help people live their best life. As one of the largest nonprofit community-based behavioral care providers in the nation, they have gathered their best healthcare providers, psychiatrists, counselors, nurses, and doctors to make sure that the people in our communities receive the best care that they can. And they're dedicated to help everyone get on the road to healing so that they can live their best life. So the organization of the agency is a little difficult to explain because there are so many different types of services and so many different types of facilities. So for instance, within a residential treatment center, you have the manager for that center, you have day shift, night shift, and most of those centers are tied into a larger full service center where the individuals in that facility receive treatment from the full service centers as well. So I'm going to talk about the larger structure of Centerstone for a second. Their CEO is Mr. Guth, and it's a multi-state not-for-profit agency with a fundraising foundation, a research institute, a speakers bureau, a hospital, and over 80 sites across 4 states. Each state has a state supervisor, then each site has its own supervisory structure with a site manager and supervisors for each division within that site or center, keeping in mind that some sites are residential facilities and have much simpler structures. The part of the Alton Center that I work for is called outpatient services. There are multiple services provided in Alton, and outpatient services also has grant-driven services within it, such as the First Experience of Psychosis program. Within outpatient services, there are 2 division or team supervisors. They are Brittany McCready, who is my supervisor, and Brittany Shamble. There's also an internship coordinator for the Alton Center, and his name is Chris Legidal. The outpatient services team has shared staff support, dedicated clinicians, full site psychologists and doctors who work with them, and they work closely with the other teams in their center like Access and SUDS or Substance Use Disorder Services, Human Resources, the Pharmacy, Primary Care or In-Home Services, and the Diversity, Equity, and Inclusion Manager, who happens to be Kayla Spikes. Their method of gaining revenue, is through direct payment from insurance payments, which might be private, Medicaid or Medicare, and through direct payment by clients for services. Additional funding comes through their foundation, whose president is Ramona Rhodes, whom you see on the right here. The foundation solicits and oversees donations, endowments, and investments. They organize fundraisers and conduct campaigns. So a fundraiser would be similar to something like a luncheon. And their upcoming luncheon is called Transforming Lives Luncheon. Centerstone serves over 170,000 clients nationally, 12,000 of them in the state of Illinois, their newest and currently smallest branch, 4,000 of whom approximately are served in Alton, and approximately 1,000 of those are assisted through inpatient services. The largest services provided at Centerstone is the SUDS program. The common role of a social worker at Centerstone is dependent upon their position within the program. So they could be attached to SUDS. They could be attached to the family program. In outpatient services, a social worker would provide individual therapy. It could be in support to the SUDS program or for people with mental health issues in general, or behavioral health issues. Pointing out that behavioral health refers to maladaptive behaviors and mental health issues refer to genetic or physiological health issues. Social workers in this role also need to meet weekly with their team to discuss team-level issues, organizational updates, and other employee-related issues. But they also need to do like upcoming events. They also need to do staffing meetings to discuss client progress, resource management, and staffing needs. In other words, if there's a client who has a particular type of insurance, that person needs to be paired up with a clinician who is paneled for that insurance and has an opening for a new client. There are also employee resource groups, which are voluntary, and they include cultural distinctions, ethnicity, military, disability, community alliance, and women. They include informational sessions and lunch and learn workshops. These social workers also lead support groups. They could be focused on grief, anxiety, SUDS, caregivers, parenting, trauma, among other options. Social workers are also responsible for documenting all of the services they provide, updating care plans for their clients, supervising interns like myself, and providing specialty services like art therapy. And my role as a generalist in the outpatient services is varied. Each week, I may be focusing on a new task or continuing tasks. For instance, this week I did care management for clients in the FEP program who have had their first experience with psychosis. And this is a wraparound program that provides medical assistance, counseling, resource management, and various other things like family education in care and support groups. I also worked on self care. I started by building a resource file for outpatient services, and the human resources asked if it could be center wide. And then when I shared a weekly post with outpatient services, human resources saw the post, liked it very much, and asked if they could share it with everyone in the state. And because of that, the agency-wide person in charge of marketing asked if I could do a column for the agency newsletter, which was a great compliment. And it's wonderful to think that self-care resources are going out to so many clinicians, because this is kind of the silent competency in social work that everyone should practice. I've also done research building in updating and adding files for clinician resources, leading an interest group in white culture and counseling, which is basically, I will point out, I did not come up with the title of this program, but it is like the first stage before something becomes an employee resource group. And it's basically looking at how European American counselors can identify their biases and acknowledge the issue of microaggression and other issues that might come into play in providing services to clients from oppressed or marginalized groups, and what they can do to improve their culturally relevant care for these clients. I am scheduled to become the liaison for Lewis and Clark Community College to provide mental health training opportunities for students. I have done warm handoffs when a clinician has left the organization and clients need to be paired with a new clinician, and also in client re-engagement for clinicians who have clients who have been out of touch with the agency or not been attending their sessions. I've shadowed clinicians in support groups and have been asked to co-lead the Big Emotions support group for a week. I've also shadowed in Access for assessments and crisis. I have weekly supervisory and staff meetings. I've participated in extensive trainings. And I believe that is all the things I've been up to at Centerstone. To give you some access to some of the literature or resources for Centerstone, I'm linking here the YouTube channel for Centerstone so that you're able to look at some of these videos. I've also uploaded my PowerPoint if you'd like to look further at them. But I just want to show you one that is very short. This is the Centerstone Beautiful People campaign based on a quote from Elizabeth Kubler-Ross, which you may know for her groundbreaking work in grief.
Some of the most beautiful people are those who have known loss and remained whole, faced addiction and fought to break free, endured depression and found hope. They've known abuse, crisis, bullying, neglect, and found the courage to recover. Beautiful people don't just happen, they fight for it. Centerstone.
There is also a video on their values campaign, their noble purpose, and I shared a story from someone who was involved in their SUDS program, a video on what to expect in your first visit, and if anyone is interested, there's also a video on careers at Centerstone. Additionally, I wanted to talk about a policy that has direct effect on the services provided to those clients who are served at Centerstone. And I will point out that this bill, although passed in August of 2021, does not go into effect until January 1st of 2023. So this is looking ahead. In the state of Illinois has passed House Bill 2595, which requires all insurers to provide coverage to treat mental, emotional, nervous, and substance use disorders because mental health is an essential part of healthcare. They're also going to start monitoring insurance companies' compliance and why they may or may not have rejected particular individuals. This bill will also provide care for mental and behavioral health and substance use disorder treatment for Illinois residents who are privately insured or have access to Medicare and Medicaid. And both the state of Illinois and Centerstone will be working to advocate to potential clients to enroll in private insurance or Medicaid if eligible, to allow more people with these issues to be able to access these care and treatment opportunities who have not previously done so due to the expense involved. To give you just one slice of the possibility of why this is important, if we look at substance abuse disorder services, it has a wide range of services that are provided within it that people may or may not have access to because they don't have insurance, or their insurance will not cover it because it's mental health related or substance use disorder related. And to give you an idea of just how many people need to have access to SUDS, the SAMHSA, which is the Substance Abuse and Mental Health Administration for the United States, did a study in 2015, which really needs to be updated because this number has definitely expanded, particularly during the pandemic. But in 2015, 21 people in the United States needed SUDS services, but only 2.1% received treatment. That's only 10%. One of the main barriers to accessing these services is people think they don't need it. But one of the other reasons is financial. And another one is that the services aren't available where they live. But it is statistically proven that specialty care exponentially increases the success rate of student or substance use disorder services. As I reflect on my time at Centerstone, I will say that they are, as a whole, amazing people who are seriously dedicated to the empowerment, healing, and support of their clients. While they are a very hierarchical organization, the way they treat each other is not like most hierarchical organizations. They take an egalitarian, diverse, and inclusive approach, and they use a coaching model when someone makes a mistake. They come alongside you, explore why the mistake happened, and how they can help you build the skills to avoid such mistakes in the future. The hardest thing about my internship at Centerstone is finding a balance between my full-time job as a professor, my internship at Centerstone, my role as a mom and wife, and as an author, and as an individual with health issues. So I do feel a bit like this stack of stones you see in this slide, trying to find a way to balance it all. Thank you very much for listening to my presentation, and I hope this has been helpful.